Nestled at the heart of 84 islands, Kalangala Health Center 4 is one of the most busiest facilities you can find, especially the maternal health department, which sees about 15 mothers a day for antenatal care and about 300 per month. The facility only registers about 60 deliveries a month. One wonders where the 240 mothers go. Upon our visit to the facility, we are lucky to find Lydia Nampera, who has just welcomed her firstborn. When asked how often she gets services at the facility, she says she has delivered all her 4 children from there because she believes in the effectiveness of the services offered.
Ningamba kangende mu ddwaliro bo bayina amagezi mangi singa bamuleba bo bagaba ddagala.
Far-flung at the extreme southern part of the country, Kalangala district is about 78 kilometers away from the capital Kampala, but due to its nature as an island, it is one of the hard-to-reach areas. Nevertheless, the district has been registering progress in maternal child health services. Records from the health department at the district show that they last recorded a mortality case in April this year. Experts we interviewed for this story indicate that a mother is expected to start antenatal visits as early as they miss their periods. Caroline Nambwere, a midwife at the facility, says due to geographical challenges, many mothers are unable to meet the services, so they end up giving birth to children without getting antenatal care, which she says is dangerous.
So you may find some clients coming late for antenatal to start their first visits very late because of the geographical area. They may say, I haven't been having transport to come to the area, or to the area where they are, there are no any health centers there.
This comes after the fact that the means of transport to the health centers. The health centers are kind of far from their places of.
The 2023 Demographic and Health Survey shows Uganda's progress in maternal and child health care, with a significant decline in maternal and infant mortality rates from 336 in 2016 to 189 per 100,000 births. Infant mortality has also declined from 43 to 36 per 1,000 live births. This improvement is attributed to improved maternal health programs and the different interventions, especially in hard-to-reach areas like Kalangala.
The Ministry of Health, together with the implementing partners and also friends of Kalangala, have always been there for Kalangala. At least we have enough gadgets that help us to ensure that our clients are handled in a better way.
However, local leaders say many mothers have always relocated from the islands when they are due for labor.
We have councillors, we have different leaders on different communities. So they do the dissemination. They encourage people to go to the hospitals.
While Kalangala has registered great progress, Busi Island presents unique challenges. Busi area, which is made up of 4 islands, has only a Health Center 3 unit that serves over 20,000 people. Ruth Ainebiona, a resident of Kavenyanja Island, one of the islands of the Busi area, has had 3 children delivered by traditional birth attendant, TBA, due to costs associated with access to proper medical care.
Omwana namuzalira mu nnyumba nga sina buyambi bwonna. Namuza kuba tetulina ddwaliro. Olubuto we lwannuma nabeerako kale nga lunnuma aluma. Era terwanuma nnyo kati nagenda okulaba nga ndaba naye ng'omukyala era nali era mu maanyi nga mutuukirira nga mugabo naye olubuto lunnuma nga ngamba genda ewaka nkole ki nzijje. Ngenda otuuka ewaka ng'era olwedde era naatera okukola ki okuntu wava eri ajja ansanga era naatera osindika omwana. Naye era ekyayamba yasanga kale nga naatera nankwatirako nasindika mwana. Naye era kale naye era kusoomoozebwa twetaaga ddwaliro.
Just like her, many mothers are devotees to TBAs than medical workers. Aineviona is carrying a 4-month pregnancy and has already enrolled for traditional antenatal care.
Bw'otuukayo akutuuka n'akukebera, bw'akukebera n'agamba nti oba oli bulungi oba n'akwata eddagala ery'okunywa egganda n'alikuwa n'akuwa n'ebbumba n'agamba gira onywe ebyo naye kale oba akugamba nti lulungi oba lubi.
Others they delivered from here, others they delivered from the bush. Not even in a hospital. There is a second woman there is also delivered people at home. Like if they see your condition cannot deliver at home, they will send you to go to hospital. And when they see you can produce at home, they will do. Yeah, we know it is risky, but it depends of the transport. Like here up to Chigungu, those people they need also transport. Then there from Entebbe transport. If you don't have money, what are you going to do?
Busi Health Center 3 is struggling with retention of mothers and convincing them to deliver from the professionals. While some mothers present critical signs and conditions that can't be managed by the facility, many others deliberately prefer TBAs. Statistics from the facility indicate that at least 200 mothers make antenatal visits, but only 10 deliveries are made per month. This translates to only 5% of the mothers that give birth at the facility.
People come from very far areas, so they have no access to the health center because of transport.
Joweria Nabunya is a celebrated TBA at the island, which is evident to the number of mothers she handles per week, an average of 6 deliveries, which is one more than the health facility.
Olulinganga nnyanja olume kasalwa nga lutuuse tulina agunde ekisizo nanti balugenda kwesibamu olujjanga lwamangu wana olubajja bajjangu nomuganzi sijja kusobola genda Entebbe ngaba nyamba muga sijja kusobola kumwata teredde mu lubuto kuba bennambi manyi.
Nabunya also doubles as a businesswoman who deals in matoke as her main merchandise. She says that as a TBA, her breakthrough moment was after she attended to a 15-year-old girl who many thought was a complicated moment. This made many mothers trust her with their deliveries.
Neza sokone kuba wala abato oli omu nankakasa kuno ekikulu abantu bakuno bazaala musawo bazaala
Wiki nga bameka
okuzaalisayo nga bano baba bataano nga kwetaaga eddwaliro abakyala bali bubi.
John Segawa is a transport service provider along the lake. He recounts several incidents of mothers delivering on the lake while sailing to the mainland.
They got into the vessel. We had one lady who was now lifting the baby. She wrapped the baby into the clothing as the weather was not good, coldness and so on. Now the husband was again lifting, holding the mother, a bottle of a drip. So I had to pick the drip on one hand, then again moving. It was so painful because I could also get tired.
In 2022, Hasfa Narwanga says she experienced a life-threatening encounter when she delivered on the lake while sailing to access the mainland and connect to Busi Health Center 3.
Walo waite waliwo wetugamba nti oba waliwo eddwaliro likola ki nenga nali sina wempulya nti oba wano wannuma nitugamba tugendeko mu ddwaliro ly'Egundi ng'omusaayi kale nga gumpitamu ki mungi nenga sina wempulira nti oba mwana yakola ki oba annuma nti obajja kati ne tufunaawo eryato eryatutwala naye twali tetunnatuuka ekintu nagenda okulya ekintu ekisooka kyajja n'ekyokubiri ne kijja ekyokusatu omwana najja.
Mulimu lwekijja ne kigwa ekiro ssaawa nga 9 naye nga tekuli midwife mwekuŋŋaanya ba VHT ne mufuna ku bafamile bali oba omuntu yenna asobola okuyamba omuntu mu by'okuzaala n'agenda mu lyato. Oluusi tutuuka wakati mu nnyanja embeera n'etabuka ne bazaalirawo. Kyokka eryato wano lidduka eno omuntu ali bubi ne banne kwegamba ne mubeera mu kaseera kazibu nnyo. Mulina okutaasa obulamu bw'oyo omuto, mulina okutaasa omuntu oyo, olumu n'abasawo bakudduka ate bwe mugoba ku showa mulina ate okufuna entambula ematumbi budde okwakisesinga embeera eyo kufuna abasawo. Kati bizibu.
The dilemma. All these incidents are handled by Nabunya, the TBA.
Oyo omwana ne muzaalisa naawe kumwala awo wennyini nali nva kusuubula. Mwana gye n'aŋŋamba bannange ani asobola okuzaaza maama wange. Ne nzuluka ne mbagamba nti ate wali buzibu. Mwana yajja alina endira nnya nga zimwesibye mu bulago. Ne nnyambala gulavu ne mugasooka ndeko okusindika ne mutwala ne nzizza emabega ne nkwata omwana musala. Tubagenda okujja okusasamala mwazo omupaadinga mugyewo wansi olwagwa. Twanguyangira umanye ebyamangu otakukoona wansi wakyafu mugalero omwana n'amala.
District authorities have deployed several members of the village health team to mobilize women against attending to TBAs in vain.
Bamulerwa bawano ebiseera bisinga basaba na mitwalo 10 naye olaba nti wali bwerere naye agenda okumaliriza okutambula okuva wano era nga kumpi bifaanagana. Ate oluusi n'atuukayo ng'abasawo tebaliiwo. Okusinziira wano nga bwe hard trach nti olumu abasawo oyinza obutabasangawo. Okiraba kati ne tubeera n'obuzibu obwo nga kisobola omwanguyira okugende wa mulerwa.
The hard trach allowance. You know, it's a kind of a motivation tool which at least can keep someone at work and then enjoys that privilege to work to serve with all her heart. But when the government really fails to notice that even Bosi sub-county is a hard-to-reach area, it means that they just will continue putting the lives of many people at risk of death.
Nakaseko Hospital has many times been in the press for bad reasons. The hospital has had court cases over negligence of staff, resulting in mortality. The district hospital is a referral destination for hundreds in Nakaseke, Luwero, Wakiso, and parts of Chiboga districts. This year, the district has registered 2 maternal and infant mortality incidents. One case involves a mother referred after the uterine rupture and death of a fetus. The second incident is registered as a medical dilemma due to a silent rupture.
Despite that, we managed to rush her to theater to try to get, but the silent rupture was not realized a little bit early, so that caused her cause of death. That is the second case we had.
While these mortality incidents leave a toll on the relatives, midwives are psychologically affected.
Like as I talk for the other one of the silent rupture, this midwife was for night duty. The midwives even remain throughout in the hospital. Yet she's supposed to come for another duty. Who was asking herself, what did I not do? Did I not perform correctly? She was actually totally confused. So when such things happen, you will find the midwife blaming herself because she has not saved both lives. So it normally tortures them psychologically. And that is the time where now when we do auditing is when a midwife can come out of that self-blame.
Introduction of periodic maternal and prenatal death review assessments is helping midwives and doctors improve their work.
We start analyzing this form of this mother from the beginning, that is page 1. We look through, when normally the front page is written by a midwife, followed by the clinician. We assess the documentation. What did we write right? What did we not write correct?
The hospital administration has also pinned standard operating procedures to help midwives recollect themselves in cases where they've gone wrong. Midwives are also able to alert each other whenever referral is going to be made or consult each other on any ethical dilemmas and complicated cases through a joint WhatsApp group.
That WhatsApp group
helps us as midwives under MCH in a way that in the lower facilities, someone is able to communicate, to do pre-communication before referral of a client, of a mother. And here we are able to prepare for that mother. By the time the mother reaches to us, we already prepared for her.
Dr. Bernard Okong, the hospital medical superintendent, says staff motivation, presence of a Class B ambulance for quick referrals, ultrasound scan machines for early diagnosis, and a neonatal unit have been fundamental in improving maternal services to evade past incidents. However, the hospital is still grappling with power instability, a dysfunctional high-dependency unit for mothers who need continuous monitoring, and blood shortage is another challenge that, if not addressed, can easily account for maternal mortality.
Inadequate blood, because many times we have small quantities of blood for transfusion, because the leading cause of death in our mothers at the time of deliveries or cesarean section, whether it's normal delivery or cesarean section, is the loss of blood. And medically we call that PPH, that's postpartum hemorrhage. That's bleeding after delivery. Now, usually when to resuscitate the mothers, we have to give them whole blood, fresh whole blood. And usually the blood bank has small quantities. So sometimes we may have to pick, because we have small quantities, we have to go several times, maybe twice in a week to pick blood, or they don't have.
The Ministry of Health took a community approach towards eliminating maternal and infant mortality through enhanced training of village health teams to link mothers to health centers in time.
The real grassroots work that involves engaging people at lower levels, at a community level, is done by our community health workers.
Dr. Richard Kabanda, the commissioner in charge of mobilization, says traditional birth attendants are still a menace. However, they can't police them.
One of our avenues was to engage VHTs to ensure that they map out the TBAs in their communities and constantly, regularly engage with them. Because if a mother comes to the TBA and TBA is not able to deliver this mother, it is prudent that the TBA links up with our VHTs to ensure that the mothers are linked to proper care in a timely manner. That has been one of our approaches, because we know we wouldn't be able to police the TBAs, all of them at the same time, and weed them out of the communities.
Robinson Namalagwe is a VHT at Busi Island, who's devoted to improving maternal and child health in her community. Namalagwe, with her records, often checks on the expectant mothers to monitor their conditions. When she detects challenges, she encourages mothers to visit a health facility rather than going to traditional birth attendants.
Mbatambulamu kasita manya nti wa lubuto ngendayo ne ntambula ne mugamba munaye mbadde njagala ojjeko kuki continental era bamanyi nkugamba bafuna abamu embuto bwe ngendayo bansekera otuuse konze ntuuse ekinkakatako kujja bakubiriza mugende mu ddwaliro lyaffe erya gavumenti sekusindika walala.
Cultonscovia Nakamya, her story.